Good evening. Welcome to APTN National News. I'm Dennis Ward. At this hour, there are roughly 500 cases of COVID-19, with the province of British Columbia still to report. On day 2 of the COVID-19 daily briefings in Ottawa, the Prime Minister and COVID cabinet agreed on one thing: Indigenous communities are most at risk if the virus takes hold. But as Todd Lamoran reports, details for dealing with such a scenario remain scarce.
On Tuesday, Justin Trudeau asked Canadians to help slow the rate of infection.
Our doctors and nurses need your help. Your neighbors need your help. Vulnerable people in the community need your help. As much as possible, stay home. Don't go out unless you absolutely have to.
Prime Minister told APTN he's working with Indigenous services to keep Indigenous communities safe.
We know that there is a higher degree of vulnerability. There are already vulnerabilities because of difficult conditions in so many of those communities. That is why we are taking extra measures to ensure that Indigenous people across this country remain safe.
He didn't say what these extra measures are. The COVID Cabinet Committee press conference afterward was also scant on detail.
Obviously, there are communities that present, and in this case, Indigenous communities, that present a higher risk for contracting COVID-19 and a higher risk for serious outcomes. So I think the Prime Minister is right to say that Indigenous communities require extra attention and extra support to make sure that their members are protected and that they have the same level of health care should we see an outbreak in an Indigenous community.
The COVID committee seems to support the actions of some Indigenous communities and organizations to declare their own states of emergency.
And that's what we need to do. We all need to be acting and taking the right measures in our own communities, and that very much includes Indigenous communities. At the same time, the federal government is here to lead and to provide the necessary resources, and we're going to do that too.
Deputy Prime Minister Chrystia Freeland maintained Indigenous Services Minister Mark Miller's absence from the briefing was not an oversight.
Minister Miller was with us in our Coronavirus Cabinet Committee meeting just before this. He will, the idea behind these daily briefings is ministers who have particular announcements to make will be here.
Freeland suggested Miller will attend a briefing later this week to soon announce specific measures for Indigenous communities. Todd Lamoran, APTN National News, Ottawa.
There has been a major new development in Ontario as that province tries to contain the largest coronavirus outbreak in the country. This morning, Premier Doug Ford declared a state of emergency to help battle the outbreak that has sickened 177 people in the province.
The first order under this declaration will be the prohibition of organized public events of over 50 people. Secondly, the following establishments are closed effective immediately until March the 31st. All facilities providing indoor recreational programs, all public libraries, all private schools as defined in the Education Act, all licensed child care centers, all bars and restaurants.
Ford stressed that this does not mean the province is shutting down and that essential services such as grocery stores and pharmacies will remain open. The Southern Chiefs Organization has also declared a state of emergency over COVID-19. The organization represents 34 First Nations in southern Manitoba. APTN's Daryl Stranger has more.
Grand Chief Jerry Daniels is still waiting for medical supplies such as gloves and masks to arrive. Even though they are expected soon, he believes the pace needs to be quickened. Daniels has called a state of emergency for the 34 First Nations he represents.
We just don't know how bad it is. If we look at what we're seeing around the world, especially in Italy, we see a G7 country that wasn't prepared. And we do not want to see the same thing in Canada. And I know that we've been acting slightly earlier, but we don't know if that's enough. And have we contained it enough? And so those are questions, and we'd rather be over precautious than to say that we didn't do enough when the moment came.
The Chief Provincial Public Health Officer says keeping First Nations informed is a priority.
Right at the beginning of enacting our incident management structure, we've had Indigenous and First Nations membership on our incident management structure. I've met regularly with many First Nation organizations, and we've directed the health regions to be in contact with the First Nations within their health region to ensure a unified response.
Daniels hopes this declaration ensures the health and well-being of the First Nations communities are protected.
We just want to see our people taken care of. First Nations are at the margin of society, 11 years less than the average Canadian. We know the underlying issues in the history, and so we want to make sure that every precaution is being taken when it comes to the health and well-being of our people.
Daryl Stranger, APTN National News, Winnipeg.
Still in Manitoba, food banks and shelters in Winnipeg are ramping up their efforts to keep services going during the COVID-19 pandemic. One organization is calling out for more volunteers to help during this time. One Just City operates 3 drop-in locations throughout the city's core. The group has had to reduce services, but are still operating a food bank once a week and had an emergency warming shelter up every night. They say the majority of volunteers are seniors and may not be able to work due to the recommendation of social distancing. Winnipeg has shut down several public spaces open to the city's vulnerable and homeless population. One Just City's executive director says this move has pushed the group to continue to whatever services they can.
Closure of libraries is a huge thing. The closure of community centers is also a huge thing. If you think about how many times you use a washroom in a day, we're asking people to hold that in. We're asking people to do that in back alleys. We're asking people to do that without proper sanitation at a time where we're saying, please step up the sanitation. And so for us, that's why it's so crucial that we remain a bathroom access point for folks that are experiencing homelessness.
Alberta also declared a state of public health emergency today. The number of cases in the province have jumped from 14 on March 10th to 74 as of Monday. No space can have more than 50 people. That restriction includes churches, grocery stores, weddings, rec centers, and airports. The government is allocating $60 million to help support social services to the homeless, women's emergency shelters, and community support services. They have not given a time frame for the restrictions to be lifted. In other news, the Canadian Human Rights Tribunal has ordered Canada to pay the parents and guardians of children who died in the unreserved child welfare system. Monday's ruling comes 6 months after the tribunal ordered Canada to compensate First Nations children who were removed from their homes and put into a purposely underfunded child welfare system between 2006 and present day. The new order instructs Canada to compensate the estates of children who died in the system and also those who entered the system before 2006 but remain in care as of that date. Coming up, we'll get the latest on COVID-19 in Quebec and the Yukon. Stay with us. Here's a look at Wednesday's weather forecast starting on the East Coast. +5 for Halifax, -14 in Nain, 7 below for Happy Valley, Goose Bay, +4 in Montreal, -1 in Saguenay, +3 with rain for Toronto, rain, and +5 in Ottawa, +1 with snow for Thunder Bay, -2 in Sioux Lookout, 21 below in Churchill, 18 below in Puckatawagan. -6 and snow for Winnipeg and Brandon. -10 in Saskatoon, 6 below in Regina. -10 for Meadow Lake and Buffalo Narrows. Welcome back. Now with 50 confirmed COVID-19 cases in Quebec, communities and public health officials are buckling down amidst uncertainty over how the pandemic will play out in the province. Lindsay Richardson has more.
The update came by afternoon. As of this writing, 74 Quebecers now diagnosed with COVID-19. 3,500 are being tested or observed, and the numbers keep changing. Though not the emergency declaration anticipated, Premier François Legault came with a message. Time off does not mean time to party, he said. Quebecers should heed warnings and stay home. In Kahnawake, those orders came from above. Schools and school playgrounds will remain empty. Hospitals are restricting access. Arenas, daycares, bars, and bingo halls all closed indefinitely. All iron workers, many of whom work in New York City, are ordered to return immediately and self-isolate, or stay where they are. These are just a few supplemental measures taken as officials double down while the virus continues to propagate in and around Montreal, so far forcing closure of prominent hubs like Native Montreal and the Native Friendship Centre. Homeless shelters are struggling with both stock and staff during the overflow, including an influx of First Nations and Inuit clients. In a statement on the COVID-19 pandemic, AFNQL Chief Ghislain Picard urged the population to consider all health measures. He says several factors, including, quote, remoteness, overcrowding of living environments, and the precarious state of health make Indigenous peoples particularly vulnerable in a pandemic context. In Kuujjuaq, in the Nunavut region, several people are undergoing screening, as are a handful of residents in the Cree community of Namaska. Meanwhile, as Canada looks to fortify its borders, the Innu community of Iqaluit is turning away non-residents. So is the Cree community of Waskaganish and the Adikamek community of Wamotashi, where police are stopping cars. Other communities are rallying for traditional remedies, like the Algonquin community of Kitsisakik, where elders are stripping cedar branches to prepare preventative medicine bundles. Quebec, meanwhile, is appealing for blood donations, will be opening more screening centres and increasing infoline staff, and is offering to compensate those put off work, preparing for the worst, which may or may not come. Lindsay Richardson, APTN National News, Montreal.
There are still no confirmed cases of the COVID-19 virus in Nunavut, and the territorial government has started a daily briefing to keep residents informed. One of the questions they have been receiving from residents, why aren't people getting tests for the virus before symptoms arrive? According to Nunavut's chief public health officer, that would be bad science and could create more risk.
If you are exposed on Thursday and swabbed on the Saturday, the test will probably come back negative, and 4 days later, when symptoms appear, people tend to think that since they were tested, they don't have to worry about COVID, and will then spend several days out of isolation spreading the infection.
It's not uncommon for Canadians to visit their local supermarket for hygiene supplies, only to find the shelves completely bare. This problem is rapidly growing nationwide, and Yukon is no exception. APTN's Chris McIntyre has more.
The local supermarket.
Yeah, what do you think? Yeah.
A place where customers go to choose from their favorite foods and household products. Usually at any given time, shelves sit full. Lately, it's a struggle for consumers to find basic supplies.
I think people are kind of nervous about what might happen if we can't get them anymore from the coronavirus. We're seeing a lot of things go way faster than they normally would, for sure.
Matt McCarthy is the manager of a local store in Whitehorse. Like many stores across Canada, keeping toilet paper and hand sanitizer stocked has been difficult.
We put in, pretty big order last week, and it came in and all the toilet paper was gone in 4 days. And then we ordered a little bit this week, and some of it's not coming, but we'll get a little bit. We actually just put a case of hand sanitizer out in the front till, and it's gone. That was probably 20 minutes ago. So yeah, it's things are going quick.
There is still no confirmed cases of COVID-19 in Yukon. In a media briefing this week, the territory's chief medical officer, Dr. Brendan Hanley, confirmed that.
COVID is now in all the provinces, and only our 3 territories have yet to announce a first case of COVID-19. But let's be clear, this is coming to Yukon and could well be here without us knowing.
As events continue to get cancelled in the city, Yukoners have started to prepare for the situation to get even worse, which has led to buying in large amounts.
My partner identified that we needed to stock up on a few things, and we're out of sugar.
and downtown there was no sugar left available, so here I am.
Even though Justin Lemfers isn't letting COVID-19 change his day-to-day routines, he is concerned for the more vulnerable citizens during the pandemic.
We're mostly thinking about friends and family who might not have as much capacity to look after themselves, or people out there in our community, and then what might we be able to do to help out in those situations.
While the risk continues to remain low, it is expected that COVID-19 will eventually make its way to Yukon. The best thing to do to prevent coming in contact with the virus is to practice social distancing and staying home, especially when not feeling well. Chris McIntyre, APTN National News, Whitehorse.
With the COVID-19 pandemic occurring on both sides of the U.S.-Canada border, many in BC are expressing their concerns over why the federal government is still permitting American tourists to travel into the country. APTN's Tina House has that story.
BC government officials held a press conference in Victoria.
The vast majority of our cases have been imported cases, and we now recognize that there are no safe places around the world.
Since the COVID-19 pandemic began, the lineups at the Peace Arch border crossing have slowed down considerably, but there are still Washington State's residents coming into Canada. For now, the USA-Canada border remains open, despite the fact that over 900 people in Washington State have tested positive for COVID-19. There's also a rising death toll of over 50 people. The BC government has very serious concerns over Washington State residents visiting BC during this pandemic.
We remain concerned that access from visitors from the United States continues to be allowed. Given the situation, particularly in King and Snohomish County in Washington State, which affects British Columbia more than anyone else, it's our strong view and it's our strong message that visitors from the United States not come to British Columbia, don't come, because at this moment that is the wrong thing to do.
The statistics around our health, are not that great. Any exposure of any kind, whether it be elders or those that are maybe battling some kind of other disease, it puts them at greater risk.
Premier John Horgan also agrees that the border needs to be more closely monitored.
We've been making it clear from our side that when it comes to Washington State particularly, and I spoke with Governor Inslee yesterday, serious challenges there. He no hard feelings. He absolutely understands. His message to Washingtonians is the same: stay home. If you're going to be self-isolating for 2 weeks, better to do it in your own home without any impact on a healthcare system, whether it's an American one or a Canadian one.
Meanwhile, the federal government says they have no plans as of yet to close the border. Tina House, APTN National News, Vancouver.
Back now to some of the other news today, and a Winnipeg judge has ruled the Manitoba government was well within its right to cancel a $67 million agreement with the Manitoba Métis Federation. Manitoba Premier Brian Pallister canceled the agreement in 2018, calling it, quote, persuasion money, unquote. The MMF filed for a judicial review, asking the court to overturn the cancellation. The deal was made between the previous NDP government, the MMF, and Manitoba Hydro. The agreement for the MMF support on a variety of hydro projects, including a transmission line to Minnesota. In his decision, Chief Justice Glenn Joyelle stated the directive is a lawful and reasonable exercise of Cabinet statutory power to enforce its stewardship role over hydro. Pallister welcomed the decision.
We don't engage in the purchase of the rights of Métis children yet unborn from Mr. Chartrand. We're not using Manitoba Hydro as an ATM to buy friends, and that's a change from the previous government's practices. And I would encourage Mr. Chartrand and anyone else who has concerns about any future projects to participate fully in the process of engagement and not expect to be paid to get out of the way.
Manitoba Métis Federation President David Chartrand was not immediately available to comment on the decision. Earlier this month, the Transportation and Safety Board released findings from the 2018 pipeline explosion in northern British Columbia. That forced the evacuation of the Lheidli T'enneh First Nation. The community's leaders are upset with the report's results. In February, Clately Tene near Prince George initiated a lawsuit in BC Supreme Court against Enbridge, the pipeline operator, seeking damages to have the pipeline removed from the territory. This is Clately Tene legal representative Malcolm McPherson.
It's scary. It was that way for many reasons. The main ones being that the safety protocols were not followed by Enbridge prior to the explosion, and the TSB report found that there was no good reason for the deferral provided after they investigated.
A new episode of Face to Face airs tonight, right here after the news. We have a preview for you coming up after the break. Here's a look at the rest of Wednesday's weather forecast, picking back up in northern Alberta. -8 for Fort McMurray. -7 in snow in Medicine Hat, Calgary, and Red Deer. 14 above under sunny skies for Vancouver. +2 in Fort Nelson and Prince George. -2 in Old Crow and Whitehorse. -4 for Fort Simpson and Wrigley. 18 below in Sax Harbor, 12 below for Paulatuck. -26 in Repulse Bay, 25 below for Whale Cove and Cambridge Bay, -30 in Resolute. Welcome back. The exuberant Earl Wood is our guest on an all-new episode of Face to Face tonight, right here after the news. Wood, who has worked the powwow scene for years, is also a member of Northern Cree Singers, who have racked up 9 Grammy nominations and 2 Juno Award nominations. But of course, it's his recent hosting duties on Rogers' Hometown Hockey in Cree on APTN that has pushed Wood into the spotlight. Wood says the reaction to that first historic game in March 2019 was incredible.
Holy smokes, it was overwhelming, and the phone was just freaking gonna blow up, right?
Mm-hmm.
People were calling, they were texting. When I went home, people were shaking my hand. They were saying, hey, I said I want my, the elders, it give me a big sense of pride when the elders, make you cry, when you see those elders. They kind of appreciate and they're happy because they're the ones that we got to thank them, because they're the ones they're the reason why this language is still here. Because they're the ones that kept it alive, and they were the ones that were even more persecuted than us.
And that episode with Earl Wood is just moments away. I would stick around for it. Earl will lift your spirits. That's your APTN National News for this Tuesday. Stay up to date with the very latest by visiting our website, aptnnews.ca, and by downloading the APTN News app. I'm Dennis Ward. Thanks for tuning in. We'll see you back here tomorrow.